tell us a little bit about your study, just briefly, and the results, just in a nutshell.
Yes, in our study, we're trying to capture people very early after infection and institute immediate ART in order to try to decrease the reservoir size to the minimum and eventually add another intervention to try to achieve functional cure of HIV.
Right, which would be one of the eradication drugs, one of the activation drugs.
So I think this is one of very few studies that screen large numbers of people who come for HIV testing in real time to find acute HIV infection. And then, like I mentioned, we screen about 52,000 to identify 89, and we turn around very fast in order to start treatment within days of confirmation.
And how long is the overall study?
The overall study goes on for 5 years.
5 years?
Yes,
okay.
It's still ongoing. We now have 95 patients in the study.
Wow, okay. And one of the questions that I had when you were giving the press briefing was, you mentioned the reservoirs that were checked, the compartments that were checked were the memory cell compartment and the gut. Did you check other reservoirs, or are you planning on checking, for instance, CNS or lymph nodes?
Yeah, we're planning to add lymph node biopsy to our study. We already have CNS compartment studies. We do MRI, MRS, we do lumbar puncture. And we do identify virus as early as 5 days after infection in the CNS.
Okay.
And the sequencing of the virus in the CNS is very similar to the blood, so we don't see compartmentalization just yet.
Oh, okay.
And we also looked at other cell types like monocytes, and we don't see any infection in the monocytes.
Okay. Oh, wow. So it's a very thorough study. You're looking at pretty much all the known compartments.
Yes, but it's not everyone agreed to optional procedures, so
yes,
the numbers.
That was my next question.
That. We've been very lucky, very fortunate that Thai patients are very, they volunteer for science, and so we have acceptance rates for optional procedures around 60 to 80%.
Oh, that's amazing. That's amazing. Are they compensated for the studies?
Yes, but not to the point that you would be able to live off
right.
it. Our patients are young MSM who are highly educated, and I think they come in knowing that it will not benefit them personally to be in the study, but rather the science as a whole.
And this is the population of people that we're going to be needing, this and other populations that may not see a perceived benefit immediately from the study, but it's encouraging to see that the patients.
And we've done a survey of our patients if they would be interested in going into a vaccine study and stopping treatment, and the majority are interested.
Okay. Well, thank you.